Alright team, here are the symptoms we're dealing with. Epoxygenase, tertiary peritonitis, and glossitis. What are we looking at here?
Epoxygenase could indicate inflammation. Tertiary peritonitis is a serious infection in the abdomen, and glossitis is inflammation of the tongue. It's quite a mix.
Could it be something like Crohn's disease, given the abdominal symptoms?
I'm leaning more towards a possible autoimmune disorder, maybe lupus. The inflammation seems too systemic for just Crohn's.
You're all off the mark. It's pseudo-hypoparathyroidism. Rare, but it fits. We need to act fast with a splenectomy.
Wait, a splenectomy? That's a risky procedure, Hawks. Are you sure that's necessary?
I didn't ask for your opinion, Gary. This is what needs to be done to save the patient. Now scrub up. We don't have time to waste. Tracy, I need to perform a splenectomy on my patient. I'm certain they have pseudo-hypoparathyroidism.
Hawks, are you sure about this diagnosis? Have you consulted with other specialists?
I don't need to consult anyone, Tracy. I've been in this field for years, and I know what I'm doing.
I understand your confidence, Hawks, but we must ensure we're making the right decision for the patient. Let's review all the options together.
I don't have time for this, Tracy. The patient needs immediate treatment, and I know this is the right course of action. Trust me.
Hawks, I appreciate your dedication, but we have protocols to follow for a reason. Let's discuss this further before proceeding with the surgery.
Fine, but I want it on record that I disagree with this unnecessary delay. My patient's life could be at stake here.
Oh no, this is not good.
The patient is in critical condition. How do I break this news to Hawks?
The splenectomy we performed was not the correct treatment for pseudo-hypoparathyroidism.
I should have double-checked the diagnosis before proceeding with the surgery.
What the hell were you thinking, choosing the wrong splenectomy? You nearly killed the patient with your incompetence.
But, Dr. Hawks, we thought...
You thought wrong, Gary? You're all a bunch of incompetent fools, unable to make a proper diagnosis.
We did our best, Dr. Hawks. We will do better next time.
Your best is not good enough. Frank, what do you think the diagnosis is?
I believe it could be a case of splenic abscess, not a rupture.
You're all useless. I can't believe I have to work with such a bunch of morons. Figure it out next time or you'll all be out of a job. Shock storms out of the room. I can't believe I haven't figured out what's wrong with the patient yet.
Maybe you need to think outside the box, Hawks. Have you considered a rare condition?
I've looked into all possibilities, Johnson. It's like a medical mystery that I can't solve.
How about a second opinion? Maybe someone else can see something you're missing.
Wait a minute. I think I know what's going on here.
Really? What is it?
I have to go take care of this. Thanks for the suggestions, Johnson.
Wait, you're leaving just like that. What about lunch?
I'll catch up with you later. Duty calls.
Well, at least tell me what you figured out.
Hawks leaves abruptly without saying goodbye. I have made a breakthrough. Forget about pseudo-hypoparathyroidism. It's all wrong.
Hawks, you can't just barge in here like this without proper equipment or permission.
This is unacceptable, Hawks. You're putting the patient's life at risk.
What are you talking about? Pseudo-hypoparathyroidism is a well-known condition.
Trust me, it's adducted thumb syndrome. I can feel it in my gut. Thanks for the congratulations, Tracy. But if you had listened to me from the start, we wouldn't have been in this mess.
Hawks, let's not forget that your initial diagnosis would have killed the patient if we had gone through with it.
You always think you know best, Tracy. This time, your stubbornness almost cost someone their life.
My job is to ensure the safety of the patients. Hawks. Maybe next time you should consider that before being so hasty with your decisions.
I know what I'm doing, Tracy. You just can't stand the fact that I might be right for once.
It's not about being right. It's about doing what's best for the patient. You need to learn to trust the process and work as a team.
I'll trust the process when you start trusting me, Tracy. Until then, we'll just keep butting heads.